Warren Buffett addressed the audience at his annual shareholders meeting this year, as a respected business leader and thought leader, the audience expected to hear his take on corporate tax reform and the benefits afforded to his business as a result. But Buffett took the occasion to send an entirely different message. In truth, he said, a specter far more sinister than corporate taxes looms over corporate American business, and that issue is healthcare cost. Now, what he went on to say was that healthcare costs are rising at a rate so rapid, right, that they're consuming the profits of corporate businesses. And he set it up this way. He said, let's compare the corporate tax rates versus healthcare expenses over a period of time. And so we went back to the 1960s and said corporate tax as a percent of GDP, or the value of the economy, was 4% in the 60s. But today, that number is just 2% of the value of our economy. So we'll keep that in perspective in terms of the magnitude. But let's look at healthcare costs over that same time period. 50 years ago, healthcare costs comprised just 5% of the value of the economy overall. Today, they comprise 17% and growing. There's no end in sight. Greater than 3 times, approaching 4 times what they were. And so now you can appreciate why Buffett and every business leader, and you and I, should also be so concerned about this cost. Now, what Buffett didn't do is talk about the ways that we can reduce cost. But I can assure you there are things that we can do and we must do to reduce cost, but also improve quality and improve the patient experience. And we need only look to other industries that have already done this. They've solved equally complex problems with resources that are very similar. So where do I get the confidence to say this? Why do I have such conviction? Well, I came out of a different space. Before healthcare, I was involved in manufacturing, specifically contract electronics manufacturing. And in that environment, we had customers like General Electric and Siemens and Juniper Networks. And these customers were extremely demanding with regard to product functionality, but also with regard to cost, quality, and the time that we would deliver. And so we literally had to put a team of people together to meet the demands of these organizations. So we had our design team from product design, as well as our test engineers, our manufacturing staff, and our procurement folks, the folks that bought the parts that were going to be used, all together around the table to design these products to meet their need. And we got good at this, right? We got so good at this, in fact, that we were known for it. So we would take product out of design, get it through prototyping, into low-volume manufacturing, high-volume manufacturing, and making a profit or revenue for our customers quicker than anybody else. And we'd call this process time to revenue. And we'd measure ourselves based on our ability to get product from design to revenue as quickly as we could. Now, we thought that was pretty good, and we felt good about ourselves delivering that particular service. But our customers said that wasn't enough. Right? What GE wanted was 10% cost reduction per year immediately after we got those parts into production. Right? So how are you going to do that? Again, bring the same team back together again. Let's understand how we can cost reduce those products in years 2 and years 3. Right? And so what we also knew was that you can't cost reduce a product infinitely. And so you can only cost reduce for an iteration or maybe 2, and then you've got to redesign that product, right, for current functionality using current manufacturing techniques, current design that's available. See, you can't lean the rotary telephone into the iPhone, right? And so you've got to start over with a brand new technique. And so healthcare can learn from that process, right, in that we're constantly iterating, right? And so I grew up in this environment where costs came down dramatically every year, not 1 or 2%, but 10 to 30%. And quality increased dramatically every year. And that was the only experience that I knew. Let's compare that now to where we are with healthcare. Okay, healthcare costs, when I joined the organization in 2007, cost accounting was not standard. And I would tell you that even today, cost accounting principles are not widely used. And because we don't have cost accounting, we can't understand the price that it takes us to deliver a service to the market, add a reasonable profit, and establish that as our unit selling price. It's just not feasible. So in the absence of that standard business process, in healthcare, the government has stood in and dictated the price for us. So Medicare establishes the price for all medical services that are delivered across the country. And if you're a Medicare recipient, you know exactly what the price is going to be. But here's the situation. As soon as those Medicare prices came out, and the physicians and the facility administrators looked at what they had to deal with for reimbursement, many of them knew that they could not make money on Medicare alone as a payer. And so they had to look to other sources to sell their services in order to have a viable business model. And so they looked to the insurance companies, and they looked to the employers, and they negotiated rates with them, higher than Medicare. And some of these organizations were relatively modest at the gains that they were able to get. So maybe 20% over a Medicare would be a modest increase for one of these providers. But others were maybe a little bit more aggressive, a little bit more nimble in their negotiating technique, and they may have gotten as much as 4 times what Medicare was willing to offer. So here you had a situation where the exact same medical service delivered to patients. If you choose location A, it's roughly $1. Choose location B, roughly $4, right? But this isn't the only industry where this issue exists, right? So any of you that have flown on an airplane recently, what you realize, when you were sitting in your middle seat in economy, something like this, the price that you paid for that seat was entirely different from the price of the seat of the fellow just next to you, right? But you were going to leave at exactly the same time. And you were going to get served the same crummy snack in flight. And you were going to arrive at your destination at exactly the same time and depart that airplane, right? So it's a very similar service, 2 totally different prices. But the difference between the airline industry and healthcare is that you can actually shop for the lowest price in the airline industry. And sometimes you can get it, right? But there are things in healthcare, right, that preclude us from being able to buy from the cheapest. It could be our insurance policy, right, that doesn't allow us access to that lowest cost provider or facility. And there's also the issue that we don't pay for all of the healthcare bill ourselves. We only pay for the first portion. And the last piece is paid by our employer or the insurance company. Right? So here you can understand basically what the healthcare system is up against and what we've got to work with in terms of a business model in healthcare. Okay? So how was it I came out of my manufacturing space and got involved in healthcare? Well, back in 2007, there were a group of doctors that decided they wanted to deliver healthcare totally differently. And so they wanted to put together a facility for bone, muscle, and joint care. And they created a building, and in this building, they put their physician offices and exam rooms, but they also added diagnostic testing, so X-ray and MRI scan, and they had a surgery center there as well to do operations on site, as well as physical therapy. And they even thought so much to add a bracing facility, an orthotist. And they created what they thought they had in terms of a much better delivery model, a one-stop shop. But when I was introduced to that, and I saw what it was, it felt to me more like a medical mall, right? I still had to do the shopping myself as a patient. I had to go from storefront to storefront. I had to deal with my own appointments and calendar and inefficiencies with that whole model. But I thought to myself, what if? What if we could take that model and tip it on its side? And again, think with the end in mind and draw this process forward in a aligned fashion and actually manage the care of that patient for them and give access to those doctors on the same day that you wanted to be seen. And then have diagnostic imaging there right away so that you could be seen and have a proper diagnosis rather than having to come back for another visit. And what if I could get a treatment plan prepared quicker than anybody else and then get you back to where you were prior to your injury? And what if we compared that entire spectrum of care to this manufacturing thing that I talked about, this time to revenue? And what if we called that return to lifestyle? And we were able to prepare some value, some true value in the market that patients would appreciate, that employers would appreciate. So it was with that prospect that I stepped out of manufacturing and joined this group on this journey in healthcare. And so for the first time in my career, I stood at a crossroads. The intersection of the manufacturing world that I knew aligned with metrics and costs and rational thinking in terms of pricing. And this world that I was about to know, healthcare, with all of its ambiguities and inefficiencies. But the idea was, can you make an impact? Can you make a difference by applying what you know to what you think you can do? And so far, here's what I'll tell you. The results are early on, and they're very limited in scope, but I feel really good about what we've been able to accomplish, and I think it's something that is repeatable and scalable. So let's just take one element, right? Let's pick on quality. In a surgical environment, you want to make sure you reduce infection. You want to keep infection out not only for cost perspective, but from a patient's perspective, it's a miserable experience. And so we wanted to pick on infection right away and reduce that in our environment. But what do you choose as the target? Well, in the manufacturing world that I came from, we chose what was called world-class Six Sigma, 3.4 defects per million opportunities. Very small. But in the surgery center, we were only delivering thousands of surgeries per year, so it was even smaller still. So small, in fact, that that number was approximately 0. And so that was our target. Our target was 0. We were going to eliminate infection from our operating rooms. That was our goal. And so we had to figure out a way to do this. And so we brought our medical team around the table, just like I had done previously, and figured out how to design a process that was going to eliminate infection from the operating rooms. And so some of the things were standard, things that you would consider normal. Taking care of the facilities and the equipment to have sterilization processes and protocols that would eliminate that as being a contributing factor. And then we also looked at, believe it or not, hand washing. It's one of the biggest contributors to infection in an operating room. The protocols to wash your hands. And so we made certain that not only did we have them, but that we followed them. We followed them rigorously, educating every one of our staff members on the importance of hand washing, when to wash your hands, for what duration, with what product, to eliminate that as a contributing factor. But then we went a step further. We asked the experts of infectious disease from the University of Wisconsin-Madison to come in and take a look at our processes and tell us what they thought about where we were going. And what they said was this: you've got another significant contributing factor to infection that you haven't considered, and it's you and me. You see, we as patients, we have bacteria on our skin, and if that bacteria is not cleaned before surgery, you can actually introduce that bacteria into the surgical wound. And so what the industry does is to give you antiseptic soap, and they expect you to wash preoperatively to reduce that opportunity. But I can tell you, even in our processes, our patients were completely inconsistent in the way that they used it. So again, thinking with the end in mind, drawing that education process from late in the game to very early in the game, we told these patients exactly what we wanted them to do in a one-on-one education session. And we said, here are the reasons why this is important. We want you to wash for this duration of time at this period, leave the soap on this long, rinse at this time, so we can reduce the opportunity for infection. But we went a step further there as well. We told them why. We said, hey, listen, we have created this team to reduce infection, and you are part of the team. Because without your participation, you could introduce infection into this process, and you don't want to become infected. Right? And so with this teamwork, right, this way of working, we've successfully reduced the infection rates in our operating rooms to 0.3%, right, versus the industry average of 1.5%. So 5 times less likely to become infected in our operating rooms. Now, we're not at 0, so we've got a lot of work yet to do, but I can tell you this: if we hadn't set our target at 0, we wouldn't be where we are today, right? Next, let's pick on price. So where are we at with price? Another industry that I can assure you is one of the only industries where you can have a service administered to you and you have no idea what the price is. None. And I'll tell you this: not only do you not know up front what the price is going to be, you don't know it for 5 weeks after the service, right? Because you're getting bills in the mail. I can tell you what we used to do. We'd send you a bill from the surgeon, the facility, the anesthesiologist, physical therapy, and the overnight stay. You didn't know what to pay, what not to pay. We thought we could do better. So we took our cost accounting team and our business administration team, and we looked at these procedures alongside of our medical staff. And we said, we can predict what the cost of these procedures should be, the time in the OR, who's in the OR, how it should work. And we have our quality kind of figured out. We know what that's going to be. So we should be able to give you a price, and one bill in the mail. We thought that was pretty good. But then we thought even better still. What if I could tell you prospectively what that price was going to be? What if I told you well in advance what the cost was going to be so that you could shop it? Our patients loved this idea because now they knew financially how to prepare for this big expense. Okay? And so it actually did two things. It gave them knowledge, but it also reduced their anxiety. Right? So they were less anxious going into this procedure knowing that we had thought about this. So those first two things, I think, are pretty impactful in terms of business application to healthcare. The last one I'll tell you I am most proud of, absolutely most proud of, because it is the reason why people come back. So our patients have told us in survey after survey, and after we have a chance to interview them, we love the things that you've done with cost. We really appreciate the quality. But the reason I would tell my friends and family to come and see you, the reason that I myself as a patient would come back, was because of the way you made me feel. That you actually care, that your doctors took the time to listen to me and really understood where I was and where I wanted to be post-operatively. And your staff genuinely, authentically wants to do the right thing. And it appears like they like their work, like they really like to be at work. Is that true of all healthcare people? Different, right? But here's what happened. When we challenged these people, right, to very extraordinary goals, and they achieved those goals, it energized them. It engaged them in a way that I couldn't have predicted. And that translated into a patient experience that is absolutely off the charts fantastic, and I'm most proud of that for sure. So these are the things that we can do. Now, how can we translate what we've done in a microcosm here into something on a national scale? How does this reduce the cost of healthcare overall? Well, you and I, again, have got to become consumers of healthcare. We've got to start asking in advance, what's the price of this procedure? And with increasing intensity, you'll start to get a response. You've got to ask things about quality. What's going on with your infection rate, your readmission rate? You see, you have to act like GE and Juniper, that we're driving our costs down and our quality up. There's got to be a lever, and we are it, right? Finally, as providers, we can do more too. We can continually improve our processes on our own to increase affordability and accessibility. And we need to do that. We need to press on that experience. And I can tell you this, if we continue to strive on our infection rates, to drive that number to zero, and no transparency today, I don't know what my competitors' rates are. If I hit zero, I know they're not lower than me, right? So let's strive for perfection. Let's see if we can hit it and what the results might be if we were to hit it. Because I would contend to you this, if you're striving for perfection, the competition becomes inconsequential. And we can absolutely have a positive impact on not only the cost, but the experience and the quality in healthcare. Thank you.